For me, the value of social innovation in health is it's about getting the community involved and taking some responsibility and being empowered to actually tackle their own problems on their own ground. And of course, who knows better the problems that are being faced by those people than the people themselves?
We see too much that the health is something that comes from above. But we have to move to a period when actually everybody is an actor of their own health.
I think in social innovation there's a very different perspective here. It's about seeing on the ground what's happening, having a good idea, thinking of a practical way to implement, but then starting to collect information that makes sure that you prove your point.
By working at these two levels, the government, the top, to create accountability, good governance, leadership, and working at the remote level to also help people become actors of health, that we would have a two-way conversation that would be for the good of everybody.
It's never going to be one size fits all. You know, we're never going to bring everybody into a city, so they're never all going to be sat around a hospital. So what is good healthcare for a person who's migrated to a city is very different from the rural farmer. But we need to make sure that there are different models, and models that reach people where they are and are effective in this way.
Of course, not everything is successful, and this is also what is the value of this initiative, is to put in place a system and to put the emphasis on the fact that these innovations should be evaluated. There are plenty of good ideas that leads nowhere, so these should be dropped, and there should be a distillation of the innovation which work in the idea of bringing them to scale.
For the initiative itself, it's about driving a global culture, and it's driving a culture both of approaching health from a very social and community inclusive way, but also a culture of doing this well, doing this with information, doing it with data, doing it in a way that others can pick up and can transform into their own context, into their own particular settings. And if the initiative itself brings in more and more partners and makes the information and the expertise more accessible to those who want to be implementers, then I think it would have been a tremendously successful program.